During the last video recording of COVID-19, I realized that I kept using the term inflammation, but I did not really explain what it was. So in this video, I wanted to just touch a little bit on inflammation, just to explain what it is. Inflammation is a response mechanism against tissue damage or infection in our bodies. It stimulates the body's immune system to repair injured tissues or defend against foreign organisms or pathogens. Excess inflammation is harmful because it leads to self-injury. In this case, the body attacks itself and begins to destroy the cells. In other cases, it can be exaggerated in response to a harmful pathogen, and therefore it will go haywire because it has recognized an offender and it has gone all out and doesn't know how to resolve itself. So various categories of antigens or pathogens or damage to the body can occur through various activities, both internal and external. For example, from the external environment, you can get infected by a disease-causing insect or vector that deposits some virus or bacteria into your body. For example, mosquito, Zika, and malaria. You can also eat something bad that will introduce a bug into your body. Think salmonella, think contaminated food. And you can also ingest drugs that will harm your body in one way or another and cause it to to recognize the drug as a harmful object. Other damages can be internal or physical, and those includes our bodies not being active over long periods of time, obesity, where our bodies become overweight, dysbiosis. Dysbiosis is a phenomenon whereby the microbiome or the bacteria and fungus that live within our gut or our stomachs or our small intestines will react to the external environment in a way that you wouldn't have anticipated. And when they react, they do trigger inflammation because they are telling the body whatever you've ingested or whatever is in its environment is not conducive for it, so it begins to agitate the stomach to respond or to remove the offender. Isolation and chronic stress. People who are by themselves for long periods of time will experience inflammation due to stressful circumstances brought about by the isolation. For example, current reports indicate that if you're in jail for a long time and you're kept in seclusion, those individuals do develop mental health breakdown and due to inflammation. Disturbed sleep. Everybody ought to get their fair share of sleep daily, and if you don't get your fair share of sleep daily, you will come up with infections. So when the situation is immediate and it's not in the not too distant past, so it's occurring within a couple of days or weeks, that is considered an acute occurrence. However, when the situation does not resolve and progresses and becomes chronic, or it becomes your everyday life, then we define it as chronic. And in the case of chronic inflammation, there are consequences, and these consequences manifest as disease. Types of disease that are associated with chronic inflammation include metabolic syndrome, type 2 diabetes, non-alcoholic fatty liver disease, cardiovascular disease, both the coronary artery disease as well as blood pressure, cancer, depression, autoimmune disease, neurodegenerative diseases such as Parkinson's and Alzheimer's, sarcopenia and osteoporosis, and immunosenescence or old age. Other diseases include Crohn's, lupus, psoriasis, rheumatoid arthritis, asthma, solid organ transplant rejection, and chronic bronchitis. These factors can be modulated by genetics or environment. Genetics, there's nothing we can do about it. We are born with certain certain liabilities, and there's nothing we can do about those. Environmentally, we can also be exposed to harmful environments that cause inflammation to occur in our lives. For example, people who live near farms are exposed to pesticides and herbicides, and these have been known to trigger the incidences of neurodegenerative diseases, autoimmune diseases, as well as cancer. On this slide, let's explore how inflammation protects us. So, at the site of injury, the offending pathogens, if they are alive, will release chemicals that can trigger an immune response. Otherwise, immune cells at the site of injury release inflammatory mediators, which include hormones and chemicals such as bradykinin, histamine, and prostaglandins. These mediators will dilate and widen small blood vessels in the tissue so more blood can reach the injured site. This blood arriving at the site of injury causes inflammation, or is what causes the inflamed area to turn red and feel very hot. Additionally, more immune cells will arrive at the injured tissue to help with the healing process. As more fluid enters the inflamed tissue, swelling occurs, and at the same time, mucus secretion begins to increase on any surface that can produce mucus from its membranes. This is the reason why we have stuffy noses, and that is how we are able to blow our noses to remove pathogens from the body. Another thing that happens with the release of histamine and bradykinin is they irritate nerve endings, and these send pain signals to the brain. Pain protects the affected part of the body because the brain sends a signal back to the body that it needs to protect itself. As the body is protecting itself, there's a loss of function. For example, if the offender is a smell, you stop smelling it. If your hand is the one that got injured, you may not be able to move it until you have determined whether you have any broken bones. If the offender is a nasal irritant, you will not be able to breathe and you'll have to move away from wherever it is you are. For example, if you're in a room full of smoke, what happens is you choke and you can't breathe and you have to leave that place. So there's a loss of function to protect life. When these issues are not resolved immediately, you will continue to feel ill, exhausted, and you will begin to get a fever. Changes in the blood, such as increased number of immune system cells, can be detected. So these are white blood cells that begin increasing in number, and that's because they detect that your body needs protection. If the offender is very active, septicemia or blood poisoning may occur. This is characterized by chills and feeling very ill, and you will have a very high fever. What is occurring is that the offender is multiplying quickly in one part of the body, and sometimes they will enter the bloodstream and find their way to the rest of the body. This happens in people with low immunity, or people or when the germs are resistant to drugs, such as the bacteria we have nowadays that are multi-drug resistant. Septicemia is a medical emergency and needs emergency medical assistance. So moving over to the second graph that shows the same effect but in a different resolution using a graph. So during the system I've just described is acute inflammation. Further to the redness, the heat, the swelling, and the pain, there are mediators that are released known as arachidonic acid metabolites, and these include prostaglandins, thromboxane, leukotrienes, and lipoxins. And these are mediators that are supposed to help with acute inflammation. So they are helping with enabling your body to fight whatever it is, the tissue injury or the infection that it is facing. At the same time, if you focus on the top graph, there is an increase in the amount of water that is infiltrating the tissue injury site, that is referred to as edema. With edema enters the neutrophils and monocytes, and this will last in your body for a minute because they are trying to resolve the injury that you're experiencing. Once they are done with cleaning up the debris as well as healing, beginning the healing process, they will start to synthesize what we call specialized pro-resolving mediators. These are proteins and lipids that are meant to help resolve the inflammation and take our bodies back to homeostasis. These resolvins and protectins, or resolution proteins and lipids, are derived from omega-3 fatty acids known as specifically as eicosapentaenoic acid and docosahexaenoic acid. So as these molecules are being released, the inflammation is being resolved in the body and we are trying to go back to normal. If this situation is not resolved, we end up in chronic inflammation and disease. So in the last video, COVID-19 video, when I talked about immune boosters, vitamin D, omega-3, and cannabidiol, these three are working in conjunction in the inflammatory cascade to either help with the diminishing the inflammation, the acute inflammation in the body, or to enhance the ability of the body to resolve the inflammation. So omega-3s are the ones that are used to derive the resolution proteins, while cannabidiol is used to shut down the inflammation, some of the inflammation proteins, and as well as enhance some of the resolution proteins and lipids. Vitamin D, on the other hand, is key in helping to switch cells from an inflammation phenotype to an anti-inflammation phenotype, thus helping the body return to homeostasis. I hope that explains the inflammation, the role it plays, and how the three immune modulators might actually help your body recover from COVID-19 or any other infection that you're facing today. Thank you. Please leave questions below or comments and let us know if there's something you'd like to hear about, and we'll be glad to help.